Hi everyone, this is Kiran, your Nclex coach. I hope you all are doing well. So I have a lot of question about how to answer select all that apply and how to approach those questions. Everyone facing some challenges to answer those questions. So I have compiled a little bit review how you can approach those questions and some of the tips that may help you to answer those questions. So today our topic is all about select multiplies. In short, is SATA. And I really value your feedback. So after this review, you still think there's something you want me to add or discuss, please do give your feedback. I really appreciate your feedback and whatever is your like whatever you want me to talk more, I can definitely do that. So let's start. I hope your day is going well. Mine is going well too. So let's start. Okay. So few strategies that I think I have compiled and I think that will definitely help you. So first of all, knowledge about content. Of course, if you don't know content, like for example, in the select all that apply question, you will be asked about a disease like pulmonary embolism. I'm just giving an example. And there are options related to those disease processes. I'm not sure what are they asking, but something related to that. So if you don't know the content, you might not be able to answer all select all that applies. So you need to know your content. So I always emphasize and I always mention you before that it's not like कि आपको सारा कंटेंट रट्टा होगा but you have a basic understanding about different topics that are common to Nclex, and that's really going to help you to pass your Nclex. And one important thing I always mention in all my sessions, and I'll try to do English Urdu, or my English is still struggling, but I mean to say that I hope it's understandable to all of you. So I always mention that NCLEX is an entry-level exam for the nurses who just came out of the nursing school and they want to enter into the practice. So consider that exam at that level. It's not that advanced. It's going to ask you some basic nursing knowledge, intervention related, like as soon as you are a nurse and you enter into the practice, whatever is needed for the nurse to be a safe nurse, that's all is about your exam. So remember that thing. So review the options like I mentioned before, considering true false statement. Like when you see select all that apply, there are five or six statement, and if you just read one statement one by one, and like let's suppose statement is saying you will assist the patient before giving the medicine. So just read that statement and categorize into true or false statement. Like assist the patient before giving the medicine is a true statement, so you will just uh, mark as a true. But if you there's a statement that says before giving pain medicine, you have not observed the pain scale or something like that. So that's a false statement. So try. It's not always gonna work, but most of the time it's gonna work if you considering all the statement to break down it true false statement. So, and one important thing, common sense, that is not common. Sometimes most of the SATA questions are like because they can't give you all of the information in the question like knowledge assist, content assist. There must be options that are common sense based. So if it look like this is making you sense, is legible, choose that option. And that always consider your gut feeling. Like sometimes what happened, we when we go to the answer choices and you feel like, yeah, oh my god, I know this and this might be a right, and you choose that, but later on after going to the question back and forth, you mark that wrong. So if your gut feeling is saying at first, choose that option. Be cautious of partial correctness. So there will be answer choices which are partial correct, looks tempting to you that you will select, but they might not be correct. So be careful. And in this review, I have we're gonna practice few of the questions, so maybe you will get more insight how to answer those questions. So far, I hope I'm clear. But you still have any feedback, any question, just do let me know. Okay, so there are a few questions that are coming on delegation. So I have, uh, there might be more points onto this, but the questions that I'm here talking about, they have like जो delegation है, it's like I have what you say, uh, categorized in the very simplest way. Okay, so first of all, when you ever see the delegation thing, what should come to your mind? You can delegate those terms that are legally allowed. Legally, what does that mean? Okay, there are a lot of delegation questions in the exam. So first, there will be, you'll see LPN and UAP in the questions that you can assign your task, and you are RN. Okay, so as a RN, what you legally assign or delegate to this personnel for the patient? Legally means like in some of the hospitals, maybe like technician and nursing assistant can do IV, but that's not legally allowed. But maybe they have certified in certain hospitals, so they are allowed. But you have to see Nclex is the board certified exam, and it's like all the channelized exams. So you don't have to consider only one hospital. You have to see what is the policies all over, and you have to answer accordingly. And you वन इम्पॉर्टेंट थिंग एंक्लेक्स जो है ना बहुत लाइक अ परफेक्ट वर्ल्ड है. वहाँ पे रिसोर्सेज की भी कोई कमी नहीं है. वहाँ पे नर्सेज भी फुली स्टाफ्ड हैं, इक्विपमेंट्स हैं, एवरीथिंग इज परफेक्ट बिकॉज इट्स अ एंक्लेक्स वर्ल्ड. So answer accordingly. You don't have any shortage of staff. You don't have shortage of supplies. So you have to answer in the perfect well. So, when I say practice a lot, that means you have to immerse yourself in that NCLEX environment. And one of the thing is you will when आप जब यू वर्ल्ड का क्वेश्चन बैंक करते हैं तो इफ़ यू हैव सीन दैट कि यू वर्ल्ड के जो क्वेश्चन बैंक है उसके जो आंसर जिस फॉर्मेट में आते हैं वो बिल्कुल एंग्लिश के फॉर्मेट से रिलेटेड है. तो क्वेश्चन सेम नहीं होगा, बट जो इसका फॉर्मेट है वो सेम होगा. सो द थिंग इज दैट कि जब आप प्रैक्टिस करते हैं उस यू वर्ल्ड से तो यू कैन इमेजिन योर सेल्फ इन दैट एग्जाम. सो दैट ऑल्सो जो आपकी एंग्जाइटी को कम करते हैं. So that's what I like about UWorld. So there are the few things that I've shorted. So licensed practical nurses, that is LPN, can monitor, check, observe. They cannot teach, plan, care, assessment, and any kind of consultation. Like there is one of the patient asks you that if I can see nutritionist or dietitian and I want some modification. So you are not to assess that whether the patient need or like NPN, sorry. RN can only do those things. So you just need to see those things. Alpine can do predictable outcome thing, basic bandages and dressing, and the UAP can like unless it assisted like assisted personnel. I think ये टर्म आपने इतनी सुनी नहीं होगी पाकिस्तान में, पर यहाँ पे बहुत कॉमन है. यहाँ पे RN है, LPN है, UAP है, टेक्नीशियंस है, CNS है. और if I recall in Pakistan, I have seen critical care technician and nursing assistant. So what I can compare with it, यहाँ पे NS जो है ना सर्टिफाइड नर्सिंग असिस्टेंट होते हैं, उनको एक सर्टिफिकेट लेना होता है. और जो यहाँ पे टैक्स है ना, यूजुअली दे डोंट हैव टू टेक एनी सर्टिफिकेट. दे यूजुअली कम इन टू द प्रैक्टिस एंड दे लर्न ऑन द बेस्ट साइड. सो यू विल लर्न. डोंट थिंक बियॉन्ड द एंक्लेक्स, दैट्स योर प्रैक्टिस थिंग. जो भी आपको थिंक करना है एंक्लेक्स करो, बिकॉज नाउ योर फर्स्ट गोल इज टू पास योर एंक्लेक्स. Okay, so let's start with some of the questions that I have compiled for you today. Okay, so we'll do some of the questions to get more understanding. So, which clients can be appropriately assigned to an LPN, LVN who will function under the supervision of an RN or a team leader? Select all that apply. So, हमने delegation को discuss किया, then we'll read statement one by one and try to categorize in true false statement and then break down the question. Okay, so first is client who needs a Pre-operative teaching about the patient control analgesia pump. So if you remember, teaching can't be done by LPNs. So we can exclude that. And this looks a false statement. So you can also do that. Client with a leg cast who needs neurochecks and needs PR and hydrocodone. So, if this this answer looks like true or false in between, so we can hold on. Client who underwent a toe amputation and has a diabetic neuropathic pain. This is okay. I think this is under the scope of LPN. Client who reports abdominal pain after being kicked, punched, and beaten. So there is need of assessment or maybe some kind of a plan. So I don't think so LPN can do. Client with terminal cancer and severe pain who is refusing medication. I don't think so. That's LPN scope. Client with arthritis who needs scheduled pain medication and heat application. So remember, LPN can do some medication like most of the oral medication. They cannot do IV medications. So there's also in their uh, scope of services. So let's see what are the right answer. So number 2 is right answer. 3 because if you see इसमें नर्स ना तो टीच कर रही है ना तो असिस्ट कर रही है ना ही कोई प्लान उसका शेयर कर रही है and so the right answer is B, C, and F. I hope you understand and make that makes sense to you. Okay, let's go to next question. Which cancer patients could be placed together as a roommates? Select all that apply. सो यहाँ पे हम कैंसर पेशेंट्स की बात कर रहे हैं और उनको देखना है कि वो किस तरह से साथ में प्लेस हो सकता है. सो वंस अगेन हमने जैसे कि हमने फर्स्ट में भी किया कि सारी स्टेटमेंट रीड करेंगे और उसको कैटेगराइज करेंगे वेदर ट्रू और फॉल्स. ओके, a patient who has a very low neutrophil. So neutrophil patients are mostly immunocompromised and most of the time they are on contact precaution. So that doesn't make logical to me. So I will exclude and mark this statement as false. A patient who underwent debulking of a tumor to relieve pressure. I think that doesn't have any kind of thing like assessment teaching. So, oh, sorry. I mean, this patient doesn't have any kind of compromise or anything that may be harmful to the patient. So I will select this and mark this statement as true. A patient who just underwent a bone marrow transplantation. Bone marrow transplantation, again, they are like a immunocompromised patient, so they can't be together with other cancer patient. A patient who had a laminectomy for spinal cord compression, excuse me, for me, that doesn't look any kind of like a obstacle to keep with the patient. Excuse me. So because it's just a procedure of your back, it doesn't have any kind of precaution or anything, so that can be an option. A patient who is undergoing brachytherapy for prostate cancer. Okay, so brachytherapy is some kind of like a radiation thing. So we won't prefer this patient to be with other patients. So we can exclude this, mark this as a false. A patient with terminal cancer who is receiving end of life care. So in the start, I see maybe some answer choices look you tempting, partial correct. So this is the statement like that. If you just read a patient with terminal cancer and cancer, you think, how okay, we can put this together. But if you see receiving end of life cancer means that patient needs extensive care. Maybe the family members are coming to see he's in pain or something like that. So why we want to bother other cancer patient with him? And it may be correct, it may be right to put those together, but if we see the second part of the statement that receiving end of life care, so it might not be appropriate for the other patient to undergo those kind of situation. So there's also the false statement. Let's see the correct answer. Okay, so our correct answers are A and D. Oh, I mean B and D, and I hope that makes sense to you. And let's go to next question. The nursing care plan for an older client with dehydration includes intervention for oral health, which is within the scope or practice of LVN being supervised by a nurse. Okay, so again एक delegation का question है, तो nurse ऐसी क्या task assign कर सकती है LPN को under the supervision, जो कि उसके scope of practice में है. Reminding the client to avoid commercial air mouthwashes, like reminding, reinforcing, that are like a indicator for you that she can do it. Okay, so she can do that. That's a true statement. Encouraging mouth rinsing with warm saline. She can also do that because not kind of an IV medication or something. So encouraging, reminding, reinforcing. These are the words that she can do. Assist skin turgor by pinching the skin over the back of the hand. This looks tempting to me. She can do some of the assessment, not all, but maybe she, let's see. Observing the lips, tongue, and mucous membrane. Providing mouth care every 2 hours while the client is awake. That's also correct. Seeking a dietary consult to increase fluids on meal care. So that looks false because in the start we discussed that LPN cannot do any kind of consultation because it comes in their nurse care plan, and care plans are done by the RNs. So let's see what are the answers for us. So that's correct. Mouth rinse is correct. Observing is again. So I told you assisting नहीं कर सकती. Observing, encouraging. So you have to pick those keywords. Providing mouth care, that's also the correct answer. And seeking a like a dietary consult, she can't do it because it's a nursing thing. Okay. So I hope this is clear. Okay, next question. The nurse is supervising a nursing student, providing care for a patient with shortness of breath who has expressed interest in smoking cessation. Which questions would the nurse suggest the student nurse to ask determine nicotine dependency? Select all that apply. Okay, so this question might look challenging because it has a lot of information, but if you read it and understand it, it's not that challenging. So यहाँ पे ना निकोटिन डिपेंडेंस की बात है. हो सकता है कि we might not know निकोटिन डिपेंडेंस में क्या होता है, but as a dependence term we know what exactly is dependence. So if we break down dependency or dependent, what is that? So if a person is dependent on that kind of, like, let's suppose someone is dependent on any kind of narcotic and he doesn't take, like वो नहीं लेता है कुछ certain time के लिए, so उसकी बॉडी डिटॉक्स होना शुरू हो जाती है और उसको वो चाहिए ही चाहिए, लाइक उसके बगैर वो सरवाइव नहीं कर सकता. तो दैट इज कॉल्ड डिपेंडेंसी. सो अगर हमें ये भी नहीं पता है कि निकोटिन डिपेंडेंसी क्या है, तो हम क्वेश्चन को डिपेंडेंसी में ब्रेक डाउन करके आंसर कर सकते हैं. सो लेट्स go forward to the answer choice. How soon after getting waking up in morning you smoke? So of course this statement is true because हमको उसकी dependency को देखना है. तो हमको ये find out करना है कि वो उठने की कितनी देर के बाद उसको smoke चाहिए. If he is dependent, he might as soon as get up and go to smoking. Okay. Do other members of your family smoke? It can be an influence on the person, maybe like a influencing thing, family dynamic, but I don't see as a dependency. So I'll exclude this. Do you smoke when you are ill? So this is really important to understand. Like जब हम बीमार होते हैं तो हमें कुछ भी करने का दिल नहीं चाह रहा होता, लाइक ना खाने का ना कुछ करने का, we just feel like just lying or comfortable. But if they are dependent on those nicotine or any kind of substance, even they are ill, they are in pain, they will definitely go for smoking. So that's correct. Do you wake up in the middle of your sleep time to smoke? If you are not sleeping like 8 hours and आपको तलब तलब हमने एक वर्ड सुना होगा, हो रही है कि आप नींद से भी उठ के करो, तो ऑब्वियसली यू आर इंडिपेंडेंट. Oh, you are dependent on that substance. Do you smoke indoors or outdoors? Okay, this might looks like as I mentioned that partial correct. So ये लगेगा कि correct है, but कुछ लोग क्या है सिर्फ outdoors ही करते हैं because they don't want to expose their family. But it's not like कि they are not dependent. So this is a tricky thing. It's not shows any kind of dependency to me. So you need to understand some people just do outdoor and they are still dependent. So this could be excluded. Do you have a difficult time not smoking in place where it is not allowed? Like as soon as who is a smoker or anything, he goes to the place जहाँ पे smoking allowed नहीं है, and he can't stay there. Like in the flight, some people don't take flight because they can't smoke on the flight. So this also shows their dependency. So let's see what are the correct options. Okay, so A, C, D, and F. So that's correct. So if you see, you will break down in true false statement, use your common sense. You can definitely to be on answer those questions correctly. And as I say, practice a lot. Practice. If you remember, जब आप as a bedside nurse first time आप अपनी practice में गए थे, तो अगर आप अपना पहला दिन याद करो और अपना 1 साल नर्सिंग का याद करो, तो आपकी आईवी स्किल्स ऑब्वियसली ओवर द टाइम इम्प्रूव हुई होती क्योंकि यू हैव प्रैक्टिस अ लॉट. So NCLEX is also like that because you have to practice question a lot in order to pass the exam, in order to understand the question thing. So practice is the key. But there are always some kind of like strategies that we can also put into our practice that can help us to answer those questions. Okay, so the next question. A patient with pulmonary embolus is receiving anticoagulation with IV heparin. What instruction would the nurse give the unlicensed assisted personnel who will help the patient with activities of daily living? Select all that of. Okay, if you see कि इसमें ना क्वेश्चन के दो पार्ट है. दो पार्ट से मीन है कि एक तरफ उसने बताया कि एंटीकोगुलेशन के लिए आईवी हेपरिन चल रही है जो कि एक फर्स्ट सिनेरियो, एंड सेकंड सिनेरियो में हमें ये बताया गया कि यूएपी है, उसको नर्स क्या असाइन कर सकती है while patient is on heparin. So if you remember the first slide, the second slide where मैंने आपको बताया कि यूएपी जो अनअसिस्ट लाइसेंस असिस्टेड पर्सनल है उसके स्कोप ऑफ प्रैक्टिस में क्या है, वो एडीएस कर सकता है, वो वाइटल साइंस ले सकता है, वो नॉर्मल मेजरमेंट कर सकता है लाइक आईओ को, and common जो regular daily living की stuff होता है. So let's break down this question. Use a lift sheet when moving and position the patient in the bed. I see that's a correct statement. There is nothing he or she can doing assessment or anything like. So that's a correct true statement. Use an electric razor when shaving the patient each day because patient is on heparin. So we have to be cautious. So that's also a in his or her scope of practice. Use a soft bristle toothbrush or tooth sponge for oral care. That's also in comes in ADL, so that's correct. Use a rectal thermometer to obtain a more accurate body temperature. So as if we see question इसमें बताया कि patient IV heparin पे है, so there are chances of bleeding. So rectal thermometers are not accurate, so that's a false statement. Be sure the patient's footwear has a firm sole when the patient ambulate. So if you recall common sense for this question, so इसमें कोई लाइक डेलीगेशन के ऐसे कोई क्राइटेरिया नहीं है, बट दैट्स जस्ट कॉमन सेंस कि अगर पेशेंट एम्बुलेट हो रहा है तो विल मेक श्योर कि वो इस तरह के सोल हो कि वो कंफर्टेबल हो, फॉर्म हो, देयर आर नो चांसेस ऑफ fall or some kind of like he can hit any surface and bleed. So that's just like a common sense thing. Assist the patient for any sign and symptoms of bleeding. So we can exclude this at all because you know they can't do assessment. So let's see what are the correct answers. That's it. That's it. Okay. So I hope okay, so I hope you have got some idea okay, select all that apply question को कैसे आंसर करना है, उसको किस तरह की strategies ले सकते हैं, content को strengthen कर सकते हैं. Like these are the simple things that I have mentioned, but we can discuss more. If you think you still need some help with that, I can also provide one-on-one consultation. If you want कि आपको one-on-one slot में मेरे से discussion करना है over the Zoom, I'm available. You can reach out to us at WhatsApp, Instagram, and Facebook. And you all know our number that is 12057616488. And please give me your feedback and what what as you want me to come with a review, so that you can have more insight of Nclex and you are more prepared for your Nclex. And I wish you all good luck for your future Nclexes, and stay tuned to Nasib Beyond Borders.